Since 2021, the COVID vaccine has been strongly recommended for pregnant women. 4 years later, a major shift from the Department of Health and Human Services. Here's King 5's Christine Pei with this week's Health Link.
What's in a recommendation? Turns out a lot. In August 2021, under the first Trump administration, the CDC said the COVID vaccine for pregnant women is safe and strongly recommended it. Nearly 4 years later, an about-face from the second administration with this announcement from Health and Human Services Secretary Robert F. Kennedy Jr.
The COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
Days later, COVID vaccine recommendations for healthy pregnant women and children are now absent.
I was really upset because it does not follow the science.
Dr. Linda Eckert is a professor of obstetrics and gynecology at UW-Medicine. She points out even healthy pregnant women who get COVID are more frequently hospitalized.
They more frequently require a ventilator for breathing. They even die more frequently. And when pregnant individuals get sick, then it's not good for their babies.
She's not alone in her alarm over the HHS's stance to remove the vaccine recommendation. The American College of Obstetricians and Gynecologists say this in part: as OBGYNs who treat patients every day, we have seen firsthand how dangerous COVID-19 infection can be during pregnancy and for newborns who depend on maternal antibodies from the vaccine for protection. We also understand that despite the change in recommendations from HHS, the science has not changed. Dr. Eckert adds pregnant women are more vulnerable to not only COVID, but respiratory infections in general.
You know, they have a different physiology in their lungs. There is even less capacity as the uterus pushes up on the lungs and makes the lungs not able to expand as well.
Pregnant women are also at higher risk of blood clots, especially if COVID impacts the placenta.
One of the reasons probably for increased risk of hypertension in pregnancy and increased risk of stillbirth during pregnancy if you contract COVID is the impact of COVID and on the vascular system in the placenta.
Eckert emphasizes COVID shots will still be available for pregnant women. The state of Washington is still recommending COVID vaccines during pregnancy. However,
some of the challenge points that is yet to be seen is how our insurance companies going to react, because they tend to follow the CDC recommendations for paying for the vaccine.
Despite the absence of a federal recommendation, Eckert says patients who are expecting should talk with their health provider about what's best for them. For HealthLink, I'm Christine Pei reporting.